Hi, I'm Dr. Caroline Leaf, and welcome to my show, The Dr. Leaf Show. In this show, we're going to be talking about postpartum depression and pregnancy health. We're going to be doing this with my good friend, Dr. Lillian Robertson, who's a board-certified OBGYN. Lillian, it is so amazing having you here today. You know, you're not only one of the most amazing doctors, because I know you are, but you're also such a dear friend. I have so much honor and respect for you. You're so filled with wisdom. Every time I speak to you, I'm so blessed and so, I just feel so at peace. Just being around you makes me feel happy and peaceful. So thank you for being here today. And I wanted to share you and your wisdom with my audience because I know what you say is going to change people's lives because it's changed mine.
Thank you. Thank you. Very kind of you. I'm so glad to be here. Thank you for the invitation to come.
Oh, thank you for being here. So Lillian, we're going to cover a series of different topics. And I felt that let's start by you introducing yourself. Tell them who you are. I've done a brief intro, but I'd love you to just, from your heart, tell them who you are, what you do, and then we're going to dive into a really interesting topic today.
Yeah, well, I'm glad to be here. Thanks for having me. I'm Lillian Lockett Robertson, and I am a native Texan now living in the Seattle, Washington area. I'm a board-certified obstetrician and gynecologist, and I've been practicing now for about 25 years in OBGYN, and it's been a wonderful life. And in addition to that, my husband pastors at Emmanuel Church in Bremerton, Washington, so I wear two hats. And so it's kind of an interesting lifestyle, but it works.
It's fantastic. So you were in private practice in Houston for quite a few years.
Yes, for about 22 years.
Wow. And then now you work as a hospitalist, is that?
That's correct, yes.
And so you're working long hours overnight.
Yes.
Delivering babies, handling emergencies.
Absolutely. My shifts are 24-hour shifts, and so I supervise midwives, I supervise residents, and we cover obstetricians and patients that come in the middle of the night. So there are all types of emergencies and deliveries, and it's just an incredible lifestyle. And you have to be a strong person to be able to do that.
You have to be on your game.
You have to be on your game.
On your game all the time, knowing how to make that stress work for you. Well, I actually want to do a show at some point about that, handling work and life and marriage and all that kind of thing. But for today, what I really wanted to dive into was discussing pregnancy pre, during and post, and the elements from a medical perspective, stress perspective, postpartum depression, sexual dysfunction potentially before and after, etc. All these of trying to fall pregnant, all the elements around that. And I know that's a huge topic, and we'll see how much we can cover. But we get so many emails, so many questions, so many people are really battling with this in this area. You know, their life just the excitement of falling pregnant, and then there's the actual going through the pregnancy and the stress of pregnancy, not being able to fall pregnant during the pregnancy, the postpartum depression, potentially post-pregnancy, the sexual dysfunction. It's a huge topic. So let's begin at the beginning. Let's talk about someone who has fallen pregnant and they've managed to fall pregnant quite easily, and then we'll talk about the person who's battling, and then just from maybe a medical and a stress point of view, mental health, etc.
Sure. Yeah, well, pregnancy is a wonderful time of life, and every girl grows up and sees herself as wanting to be a mother. And so to work with a lady who is desiring to be pregnant, that's wonderful. We do prenatal screening and counseling and just talk about her menstrual cycle and just making her healthy before she even is able to conceive. And then once she conceives, then it's our job as obstetricians to make sure that she's on good prenatal vitamins, that she's eating properly, that she exercises and manages her life, because a lot of these women are still working. Not all of our patients are stay-at-home moms, so it's a work-life balance that we have to help them navigate through, and it really does take a lot of work from us: support, counseling, prenatal classes, etc., etc. But it's a wonderful time. I think the most important thing for ladies, particularly, and it depends on your age range. For ladies that are trying to get pregnant, generally we want to make sure they have enough folic acid, that their diets are good, that their weight is manageable, that they're exercising. So mental health is a huge part of getting pregnant and maintaining a healthy pregnancy.
Well, that's okay. So that's a really, let's touch on the diet for a moment, and then let's go to the mental health side. So diet, you mentioned folic acid, but in terms of diet, is there an awareness amongst moms about how much what they are eating is affecting their baby, and not just what they're eating, but what their husband ate, and also what the previous generations ate? Is there an awareness of the impact of diet on the baby?
Yeah, well, when we talk to our moms about pregnancy or during pregnancy, we want to make sure they're at least watching their carbohydrates, because it puts them at increased risk for diabetes, which has a significant effect and impact on the baby. If a mom has diabetes, and it puts the fetus at risk for cardiac diseases and large gestational age babies, which can impact the delivery process. Wow. Because there are issues with shoulder dystocia and the babies being too large to pass through the pelvic inlet, and then increasing their risk for cesarean section. But diet is significant and important. In terms of what the father does, we want to make sure that they have a lifestyle of where they're not imbibing too much alcohol and illicit drugs and things like that. So we want, when we think of it, we're painting a picture of a baby, and you want to put as much healthy things in terms of making a healthy baby as you can, in terms of their diet, in terms of, nutrition, a lot of green vegetables, good vitamins. It's real important.
Do you find that you're needing to counsel more on that in terms of diet, in terms of healthy eating with this modern American diet? Because I know we've had this discussion before about how you're almost having to reteach people how to eat real food.
Yes. It's amazing. In the population of women that I work with in Washington, they are really suffering and struggling with the diet. There are a lot of them that don't even know what to eat.
Wow.
And so we see a lot more diabetes. Gestational diabetes is rampant, and it's directly a result of the modern American diet. Too much carbohydrates, too much sugar,
too much processed food.
Too much processed food creates an inflammatory process, which also increases risk of hypertension, and it impacts the pregnancy significantly.
I remember you telling me the ones that babies are being born obese from the mother's diet. That's a real issue, and it's a new issue, isn't it?
It's a real issue because of diabetes, and with diabetes, insulin levels are very high. And so when the insulin levels are high and there's hyperglycemia, then the kids are born, they have a lot of adipose around the shoulders. So the kids are really, really large and large gestational age. And so you can spot a diabetic baby versus one that's not diabetic, or where the mom is diabetic. So it's a real problem, and so we try to make sure that our moms are eating well. And we do that with having them in support classes, centering classes, and we have them in classes where they're learning about breastfeeding, where they're learning about eating properly, and learning about being a pregnant mom early on. And so we try to do that because it really does significantly impact the outcome of the baby.
So what you're saying is that the education, diet-wise, and just being a parent and just the whole process, is the educational part is definitely making a difference.
It does make a difference.
A huge difference
makes a huge difference
in the pregnancy and the child's health when they're born, and thereafter as well, and the mother's health. And
yes. It's so important because I see a full spectrum. I see ones that are not in prenatal classes, that are not educated in terms of what they should eat. Babies sometimes are malnourished, and babies sometimes are overweight based on what the mom has eaten. So we really have to make sure that when you're getting your prenatal classes and you're going through your prenatal time, that you really are educated about what you should eat, because it does impact.
So are you finding that you're having to tell people that this is real food, try not eat chemicals and processed food, and rather eat organic and real food and grass-fed? And are you having to tell people that in
Yes,
this
we
day and
are.
age?
Yes, we are. We're having to tell people that, and we're having to tell people to eat vegetables.
Oh my goodness.
Yeah, you'd be amazed at the ladies that
eat.
are not eating vegetables, because it's not that it's the fast food is more convenient. The modern American diet is right at your fingertips.
And it's addictive.
And people are not aware of, that's why that book, Think and Eat Yourself Smart, is so wonderful. And we use it a lot in our practice because I'm helping ladies understand what real food is. You'd be amazed.
Oh, well, that's amazing. Lillian is talking about my book, Think and Eat Yourself Smart, and where I deal with how to eat real food, and I cover the dangers of the modern American diet. And that's so exciting that you're actually using that in your practice.
Yes.
And it's helping people. Do you find that they are following the principles? Do they listen to you?
They listen, but it takes a lot of education.
A lot of education.
Because there are generations of where we are reversing bad behaviors, and and some of those foods are addictive. And so we're having to work with them to teach them different ways to work through those food addictions that are bad, and they've gotten into those habits, and the whole family and the whole culture of the family is such, eating that way. And so it's sometimes difficult for them to just navigate their way through that and make those changes, but we really do try.
That's amazing. So you said something interesting there about it going through the generations. So we've seen this problem for about the last 50 years since the advent of the modern American diet and food, the industrial food movement and so on. And you have been practicing for 25. Do you know any doctors that were practicing prior to this where diet wasn't such an issue? Is this definitely this diet issue, is this definitely a more recent thing in the last sort of 20, 25 years that we're seeing this?
I think
almost
so.
lack of...
Yeah, what I'm noticing, Caroline, our patients are bigger.
Oh,
the
wow.
ladies are bigger. I mean, the average weights for a pregnant lady to start in her early pregnancy, she's much, much larger. So there's much more morbidity among our younger ladies, 19, 20 years old. These ladies are larger, and so it's directly a result of what they're eating.
And nutritionally starved. They're larger, but they're nutritionally starved.
They're overweight and nutritionally starved. Absolutely.
That's a major issue. I remember when I was pregnant with my babies, I've had 4. And I mean, we're talking, my eldest is 27. They didn't even really talk. They just say eat a healthy diet. But in those, 30 years ago, it was still, the modern American diet was around, but it was we were much more aware. So there's been a shift. That's what you're saying. There's been a shift in the last 25 years, definitely, to an awareness of that. So if we talk about food, we're also talking about the impact of food on the mind. And just after this break, I'm going to come back and I want us to start talking about the mental health side of trying to fall pregnant and then being pregnant and take it a little bit further into the postpartum as well.
Okay, wonderful.
So we'll be back in a few moments.
Are you tired of failing? Tired of not getting those good grades even though you studied for hours? Tired of having all these goals and dreams but not able to make them happen? Maybe you're just tired of failed relationships.
But the real key to success lies deep inside of all of us, and that is in our mind. If we don't get our mind right, nothing else in our life will go right.
Dr. Leaf's latest book, Think, Learn, Succeed, includes her gift profile and scientifically proven 5-step learning process to help you understand and use your unique mind to find meaningful success in school, work, and life. Order your copy today.
So Lillian, let's touch on the mental health of pregnancy. So the excitement of falling pregnant, and then the reality that I am pregnant, and depression, anxiety, the whole change. What are some of the things that you find are an issue, and what are the tips that you give women to help them?
Well, most of the time during pregnancy, women are we don't see as much depression. They're excited about the pregnancy, unless there's some issues surrounding an unwanted pregnancy. But for the most part, if a woman is desiring pregnancy and has become pregnant, she's pretty stable until the postpartum period.
Okay, so that's
the other. And the postpartum period is when we start to notice the mental health changes. Because number one, the progesterone levels are very low, the estrogen levels are very low. Progesterone is that part of the hormone that really calms you and makes you feel wonderful and you're excited. And as that lowers during the end of pregnancy, plus moms are breastfeeding, then they have a tendency sometimes to feel some depression. So when we notice...
Sorry to interrupt you. So just to explain that a little bit more clearly, the low progesterone is going to be contributing to the feeling of a little bit of depression.
Right.
And then breastfeeding lowers it even more?
Breastfeeding lowers it even more.
Okay.
The estrogen levels are lower. Now, this is at the end of pregnancy. Yes. This is postpartum. So the oxytocin level is up a little bit because the mom is trying to breastfeed, but the progesterone levels, those are the calming ones. Those are the ones that make you, or help you manage life a little bit better. It gets a little lower. So then if a woman goes through postpartum depression, usually she's got what we call the baby blues.
Yes.
The issue with that mom is that she has real stress levels with dealing with how do I take care of this baby? You know, do I have the knowledge to do it? One of the things we try to do after babies are immediately born is put the baby on the mom's chest for skin-to-skin bonding. That helps sometimes to elevate those levels of oxytocin. If a mom is not breastfeeding, sometimes there's a detachment, there's a social anxiety surrounding
with mom and baby.
Yeah, with mom and baby. And so the mom tends to feel inadequate and gets depressed. And it's nothing that she's doing incorrectly. Sometimes it's just, it's just hormonal. There's a lot of hormonal changes that are happening after the mom has the baby. And so with postpartum blues, the dad sometimes has been denied sexually, so he's, stressed
cranky.
and cranky. And the mom has been denied sexually during a large part of pregnancy. And so it's a real stressful time. There's a new baby. Nobody knows what to do with this baby. The baby's crying all the time. Am I holding the baby correctly? I don't know. Milk hasn't come. So it can seem hard for a lot of ladies. And so when we notice that ladies have that, what we try to do, we give them tips for, let's just take a deep breath and let's just start to, get some time off, get somebody to come in and help us. Make sure you're getting support. We have lactation support personnel that can help moms with breastfeeding. We tell the dad to just help out as much as he can. And then just tell the mom, make sure you're eating properly. Make sure you're eating good, nutritious food, drinking plenty of water so that the milk and the breast engorgement can make sure that we have enough milk for the baby. The other thing we tell moms to do is to try and exercise. And if you're exercising, that helps with those endorphins and helps to, get you back on track. But the main thing during that time is to get her some support and reach out. We try to make sure.
Okay, so that's a really great tip. So it's almost like if I'd say tip number one would be education about hormones, because I don't know if they're always aware. Women are always aware. I mean, I never got told any of this. It was something that because in the field that I am, I happen to know about this. But how many women, the emails we get, they aren't educated sufficiently about how the hormonal changes may make you feel, because preparation is a vital part of being mentally healthy. If you know what to expect when it happens, you're more prepared.
Right.
So I think that the high of the birth, the pregnancy and the birth and the excitement of the new baby is phenomenal, but then it starts dropping. So I think education's a very big part of it. That these are the things. I don't know what you.
It's the role of the obstetrician. It's our job too to make sure that towards the end of the pregnancy we're preparing these moms and letting them know that your hormones are going to change. Sometimes they'll lose lots of blood. The body habitus changes. You look differently than what you looked before. And so all of those hormonal changes, it really can cause some mental health issues. And so if we can educate them and make sure that they are getting the support that they need, make sure that they're eating properly, make sure that they're exercising, and also making sure that they're reaching out for help. I think that really does help to stabilize the mom during the postpartum.
I can agree with that. I mean, I can remember with my 4 babies, I never got any of that kind of advice. It was really just have the baby, and there was no preparation, and that's a vital part. And I'm so glad to hear that that now that's becoming a big part of most practices. But that's also if it's not. I mean, this is something that there are support groups out there. There's a lot of material that people can read.
There are support groups out there, and WebMD is a real good source for postpartum issues. I like the Mayo Clinic website. They've got a really great website, and it's very practical, it's very user friendly, and so most patients in the community can really understand it. But the real issue, Caroline, for these ladies is support.
That's what I wanted to emphasize as well. You mentioned that you've said it a lot of times. You've said nutrition, exercise, and support, and education. Those are 4 things. So the education side, the OBGYN,
that's the role of the doctor, the OB provider,
and there's these sites like Mayo Clinic. The nutrition, there's a lot of help on nutrition too, and there's great books. But support's a vital factor because you're tired. You're up and down all night. One of the things that I did with all 4 kids is I used to express milk, and Mac would always do that 3 o'clock in the morning feed, which is where you just want to sleep. And then the father can bond. I mean, there's no rules, but you try and work a way that you could not everyone's got their parents around. I didn't have my mom around when my kids, she lived quite far away from me. So I didn't have that kind of support. But my husband was very supportive. So that support is vital. And
it's very important. And babies are crying in the middle of the night. And so if we can get the dads to understand and participate and help out, and if the father's not there, then,
to have someone stay.
Have someone stay.
Have someone stay with that person, not to let them be alone.
Yes, because their circadian rhythm has changed. And you're up all night, and moms are very, very sensitive to the crying babies, and all of the hormonal changes are occurring, and the body habitus is changing. It's a real mess.
It is a mess.
But it's a good mess. But it's it's a perfect storm where a lot of things can happen emotionally. And so if these ladies are aware of that, I think they can navigate through this period fairly well. We generally expect that the postpartum time is between 4 to 6 weeks, and if we can make it through that without any major crises, then medication is not something we would readily have to turn to.
Well, that's 4 to 6 weeks. If you heard what Lillian said, that 4 to 6 week period postpartum is really critical. And the major first, I'd say, from what I'm hearing you say, is support is the major first thing to have in place, so that the mom can have that rest during the day, that she's not constantly on duty to have that time out to rest, and also just to maybe be taken out for a cup of coffee with a friend, or if she wants to have a cry or watch a movie or something, to have that little bit of a break, someone else to hold the baby. As I said, express the milk. Maybe if she's breastfeeding, let someone else maybe do a feed for the baby. Those little things.
It's going to be so important to just get some time away. Go to a movie and get your nails done and have some girl time. But it's very, very important to keep that mental health.
Yeah, because you're not always feeling so great. You maybe haven't done your hair or you've done your nails. It's important that you make yourself to spend a little bit of time on yourself.
And you know what is so important too is that you look differently to yourself. And I think the challenge of, am I good enough? Am I able to take care of this baby? Did I do a good job? That's the kind of thing that we have to reassure the moms about immediately postpartum. But it's a good time for the moms to really look into, what's going to be necessary for them to feel good about themselves all over again.
I love that. I love that fact that we need to, it's almost like we need to tell moms it's okay to feel guilty. It's okay to feel, you're going to feel these feelings, so don't think you're the first person ever to feel that. Is that not something, Lillian, that you would say? Yeah. It's okay that you may, as you say, look at your body. You may not have, you've got that extra baby fat around you. You're still not feeling that great. You're not as strong as you used to be.
And then sometimes they've had surgery. Sometimes pregnancy and delivery requires a surgical route for delivery. So medically, there may be some challenges to get your body back to where it was. And so it's a really, really important time for moms. And it's a scary time because there's so many changes. And when those hormones are changing, the body is changing, the emotions are changing, mental health, it's a mental health crisis.
So people need to talk. And I think we need to encourage women when they're feeling down to pick up that phone and say, I need help, or to tell someone I'm really feeling down, not to try and be all brave and strong, because moms tend to do that. No, we're fine, but we're not fine. And reach out and say, look, I need someone to talk to me, and I need someone to just sit with me while I cry or whatever. Lillian, related to that, a lot of the emails that I get and a lot of the questions that I've had about postpartum depression in terms of mental health side, there's a consistent pattern I've seen, and it's a lack of support. Lack of two things, preparation and support. Number one, that comes up all the time. So I'm talking about the ladies now that go into that extreme where it goes beyond the 6 weeks and it's 3 months later and it's 4 months later. They're falling apart. They get diagnoses of depression. Sometimes even, psychotic diagnoses of, even schizophrenia. Some women have been, like radical mental health labels.
It's like post-traumatic stress
disorder. And it makes it even more scary. Like, oh gosh, I'm a poor mother because now I have an illness. And there's such a feeling of incompetency around it. There's the fear of all that stuff we've just described. Now they get told to have a mental ill health problem. So it feels to me like the women that are experiencing postpartum depression, baby blues, longer than the 6 to 8 weeks, they almost put into that category of being made to almost, they feel worse. And when I look at what they say, when I've talked to these women and interviewed a few of them, what's come up is they've been alone a lot. They have not had the support. They're in a prominent kind of, some of them have been very like celebrities and that kind of thing. So they expected, or pastors' wives or leaders. They expect it to just
Corporate
handle
managers.
corporate managers. Yeah. They expect it to be, hey, pull your act together. You got this baby you wanted. What's wrong with you? And so there's been a bit of a kind of brushing, but support's been a number one issue.
Yeah.
Being alone too much.
Yes. It's so interesting how once the baby's born, there's no warranty. So we hand the baby over, and so you're expected to be perfect. You're expected to be, the executive manager and multitasker and do all of that. And so when you're not able to do that, sometimes it lends to more stress even beyond that 6 weeks period. And so you have to be really, really careful during those times. And talk therapy is very, very important.
Talk therapy is very important. Yeah.
And to make sure that, and that's what we do, Caroline. If we see that these ladies are not doing as well after 6 weeks, and that's when we talk to our clinicians and see if we can schedule appointments for them to talk to someone through just how do you feel?
I love
what's going on?
I love that you said talk therapy, because a lot of these women that have that approach me from a mental health perspective will say that the minute they've gone beyond that sort of 6 to 8 week time period, they get labeled and they get medicated, and they say the medication makes them feel worse.
Yeah.
And I mean, we know when we talk medication, antidepressants is generally what they're given.
Yes.
And
we have to be real careful too,
Yeah.
particularly if they're breastfeeding and what that does to the infant. And sometimes there's, it's a slippery slope if adding medications and what the baby gets exposed to.
Exactly.
And is the medication really, really needed?
Well, that's the thing. And according to the research, no, it's not needed, because it actually can damage the brain. What we're needing is to give these people sympathy, that we care, we love them, and to help them get the support system.
Yes.
Because the research is showing that the antidepressants and those kind of things are not effective. They do make the situation worse. But the talk therapy, the support, the love, the emotional support,
the education,
that's what's the
nutrition, the exercise, the mindfulness, the positive affirmations, and just walking them through life in a way to get them back to a sense of wholeness and a sense of well-being, and that they're not alone. Really does make a difference.
Lillian, I'm going to ask you to summarize that if you can just re-say that again in a sort of closing off statement, because you said such valuable, powerful stuff.
And one of the things we said, though, is that when we hand these babies to the moms, we don't give a handbook. We just basically will say, here's your baby, and, it's beautiful. You did a great job. So when the mom reaches a state where she's depressed and has postpartum blues, the most important thing that we should do as obstetricians is make sure that we're giving them good education about the changes in the hormones, so they'll have a better understanding of what's happening to them and not feel like a victim.
Beautiful.
Secondly, we have to make sure that they're eating properly, that they're getting the adequate amount of rest, make sure that they are exercising and getting the support. Reach out for help and just tell your spouse, tell your family members, I need someone. Can someone come over and help me with the baby so that I can go and get my nails done, so that I can go for coffee with my girlfriend? Because, these are high-powered women sometimes, and women that have delayed pregnancy for a long time. Mm-hmm. And so when they finally have the babies, when they finally bring the babies home, man, it's a different life than what it is. And it's not a corporate environment.
No, not at all.
But it's a good time. And so I think the take-home thing is to reach out, get support, exercise, pray, and also make sure that you are, nutritionally stable and sound, and, working through this with your provider.
That's incredible advice. Lillian, thank you so much. I really appreciate you being here today.
Oh, it's good to come.
I'm going to definitely have you back in, because I feel like we've just touched the tip of the iceberg, and I really think we need to dive more into the whole mental health side as well. And just wonderful stuff. Thank you for what you shared. What
Carol,
wonderful information. I know that this is vital, and I know there's a lot of moms out there that are going to benefit so much from this. Remember that support, connection, that's what we're made for. Loneliness is not a good thing. And another thing is, remember that you aren't expected to know everything straight away. Tell people when you need help. Reach out. People are there. When you reach out to people, people will help you. And as you reach out to people, you're going to help yourself by reaching out and maybe helping someone else. We need each other. We really need each other in this time. And as Dr. Lillian has given you some great tips on exercise and exercise, nutrition, support, these are very vital things to help through the mental health and the whole pregnancy situation. It's a beautiful time. But it's okay to be scared. It's okay. You're not alone. I'm trying to tell you that these things can happen. These negative, toxic things can happen in your life, but it's okay, because you're not the only one who's going through that. There's so many people, all women are experiencing this in different ways. You're not alone out there. So reach out and get the help that you need. Don't be scared to say that you need help. We all need each other. Thank you for joining me today. I'm Dr. Caroline Leaf. This is the Dr. Leaf Show. And if you haven't yet subscribed, go to the bottom of your screen, press the subscribe button, and you'll be kept up to date on all things relating to mind and mental health.
Thanks for joining us today. Dr. Leaf's best-selling book will help you find the switch that will turn on your brain and enable you to be happier and healthier in your mind and body, more prosperous, and more intelligent. No diet will work unless you have the right mindset. In the book, Think and Eat Yourself Smart, Dr. Leaf will show you how to eat real food mindfully and develop a healthier body, brain, and spirit. Do you struggle to find your identity and purpose? The Perfect You will help solve life's questions by providing you with a blueprint for your unique mind. Detox your brain in 21 days with Dr. Leaf's best-selling online program, The 21-Day Detox. Accessible from your phone, tablet, or computer, this program will show you how your thoughts impact your spirit, soul, and body. To stay up to date on all things related to the mind and mental health, follow us on Facebook, Twitter, and Instagram. Thanks for watching today, and be sure to tune in next week for another great episode.